CNA Exam Workbook. Welcome to the quiz. Question 1. Specialized oral care for unconscious patients prevents complications and maintains oral health. When developing a care plan for Mr. Thompson, who is unconscious following a severe traumatic brain injury, the nurse asks about appropriate frequency for comprehensive oral care. How often should thorough oral care typically be performed for an unconscious, non-responsive patient? Option A. Once daily during the morning care routine is sufficient. Option B. Every 2 to 4 hours to prevent aspiration and maintain mucosal health. Option C. Only when oral secretions become visibly soiled or odorous. Option D. Twice weekly unless specific problems are identified. The answer is B. Unconscious patients need oral care every 2 to 4 hours. They cannot clear secretions. Question 2. Adhering to prescribed dietary modifications requires understanding specific food restrictions. When reviewing the dietary order for Mrs. Wilson, who is on a nectar-thickened liquid diet following a recent aspiration event, you must identify inappropriate food items. Which food or beverage would be contraindicated for a patient prescribed a nectar-thickened liquid consistency diet? Option A. A milkshake that has been specifically thickened to nectar consistency. Option B. Applesauce that maintains its natural semi-solid consistency. Option C. Plain water without any thickening agents added. Option D. Chocolate pudding that maintains a semi-solid texture. The answer is C. Plain water is contraindicated on a nectar-thickened liquid diet because it hasn't been thickened. Patients on thickened liquid diets cannot have thin liquids due to aspiration risk. Milkshakes thickened to proper consistency are acceptable. Applesauce and pudding are not liquids and might be on different diet textures. All liquids must be thickened to prescribed consistency to prevent aspiration. Question 3. Understanding the dying process helps provide appropriate comfort measures and support. During an end-of-life care seminar, the hospice nurse discusses sensory changes typically experienced during the active dying phase. As death approaches, which human sense is generally believed to persist longest, allowing for continued communication with dying patients? Option A. Visual perception allowing recognition of loved ones' faces. Option B. Auditory function permitting awareness of spoken words. Option C. Tactile sensitivity to gentle touch and physical contact. Option D. Olfactory ability to detect familiar scents and odors. The answer is B. Hearing is generally the last sense to fade. Dying patients may still hear and comprehend speech even when unresponsive. Continuing to speak calmly and reassuringly provides comfort. Vision often deteriorates early. Touch sensitivity varies, but may decrease. Smell may diminish. Assuming hearing persists allows for continued therapeutic communication and emotional support during the dying process. Question 4. Therapeutic communication techniques facilitate emotional expression and psychological support. When Mrs. Johnson, a 72-year-old widow recently admitted to the facility, tearfully expresses feelings of profound sadness and loneliness following her husband's death, what response demonstrates effective therapeutic communication? Option A. Don't be sad, Mrs. Johnson. Things will get better with time. Option B. I understand exactly how you feel since I lost my grandmother last year. Option C. Tell me more about what you're feeling right now. Option D. You should focus on the positive aspects of your life. The answer is C. Open-ended invitations to express feelings demonstrate therapeutic communication. This approach validates emotions and encourages processing. Minimizing feelings, don't be sad, invalidates emotional experience. Claiming exact understanding may not be accurate and shifts focus. Advice giving, focus on positive, doesn't address emotional needs. Active listening and encouragement to express facilitates emotional healing. Question 5. Proper positioning during assisted ambulation maximizes safety and support. When preparing to assist Mr. Davis, who has right-sided weakness following a stroke, with ambulation in the hallway using a gait belt. What represents the optimal positioning for the nursing assistant relative to the patient? Option A. Position yourself slightly behind and to the side to observe gait pattern. Option B. Stand directly in front of the patient to guide forward movement. Option C. Hold onto the gait belt from directly behind the patient. Option D. Stand on the patient's stronger left side for optimal support. The answer is D. Position on the stronger side provides best support and stability. The assistant can support the weaker side and help maintain balance. Being behind doesn't allow forward guidance or good support. Being in front is impractical and doesn't allow assistance with balance. Holding from behind provides poor control and doesn't support weaker side effectively. Stronger side positioning optimizes safety and assistance. Question 6. Different pulse assessment sites serve specific clinical purposes in various situations. During an emergency response drill, the instructor asks which pulse site should be assessed first when evaluating an unresponsive adult patient. Which pulse site should typically be checked initially during emergency assessment of an unresponsive patient? Option A. Radial pulse at the wrist for rapid accessibility. Option B. Carotid pulse in the neck for central circulation assessment. Option C. Brachial pulse in the arm for basic life support checks. Option D. Pedal pulse in the foot for peripheral circulation evaluation. The answer is B. Carotid pulse is checked first in emergencies because it indicates central circulation and is accessible during CPR. Radial pulse may be weak or absent in shock. Brachial is used for infants. Pedal pulse assesses peripheral circulation but not immediate life threat. Carotid assessment quickly determines if CPR is needed. This follows emergency response protocols. Great job! Don't forget to subscribe. Bye!